Houston, we have a problem. Where were you on April 13th, 1970? Because I remember vividly when Apollo 13, some 320,000 kilometres away from planet Earth, had a calamity. And those famous words from Swikat echoed round the world. And what happened with this amazing third intended moon landing was that oxygen tank number 2 exploded. They had to crawl out of the command module and into the lunar module, the thing that was going to land, the lunar lander. And that actually was their lifeboat. And what that proves to me is you can't be brave if you only ever had good things happen to you. But Australia's got a problem as well. And our problem is a mental health problem. Our mental health system, our health system, is at a crossroads. We have this ageing population. We have chronic illnesses from which people used to die but now live for long, long times. And we have the cost of the technology to treat those people, let alone diagnose them, which is crippling the healthcare system. It's simply unsustainable. So what we're going to do is we actually have one choice. We actually have to re-look at our healthcare system and acknowledge that it's in crisis. The great Dr. Phil says, you cannot change what you do not acknowledge. So I want to acknowledge the fact that we have an apartheid system in our healthcare. There are one group of people who are serviced brilliantly, the acutely medically ill. They get 21st century technology treatment. And we've got another group of people who sadly happen to get a psychological illness. And what happens to those people? What happens to those people is extraordinary. It's the exact opposite of what happens if a gentleman in this room suddenly clutched their chest and had some central chest pain, because you would be whipped off in an ambulance. If it was serious, you'd be helicoptered to Melbourne and you would get superb treatment. If you happen to get cancer, you can have 21st century chemotherapy and radiotherapy, which will probably, in all likelihood, cure you. So what do? We've got this healthcare system, the mental healthcare system, which is the poor cousin. 45% of all Australians have a mental health illness experience. When we actually look at the statistics, that's 4 million people a year touched by illness. We have 20% of all Australians that you will ever meet getting a mental illness. And yet what is so extraordinary about this is that we actually have done virtually nothing about it. 17% of Australians tell us that stress is having a severe impact on their lives. We look at the data, and what do we see? We see half of the people who need help getting help, and that's just not acceptable. So what can we do? What can we do to solve the problem? Well, if I was the Prime Minister, it's pretty simple, really. I have to find about $9 billion. I have to train up, I think it's about 8,800 mental health professionals. I've got to find them first. And none of that's realistic. So what are we going to do? We have to innovate. We have to rethink the whole mental health care system. And how are we going to do that? One of the things that is quite clear to me is that we have one advantage over all the other generations, and it's called the internet. Did you know that 4.7 billion people, or approximately 40% of the planet, is currently connected to the internet? So it seems to me that that's a logical place to go. And we have to start by investing in mental health promotion, for sure. We have to do that. We have to make sure that we look at young people. But why? Why do we have to start looking at young people? Because 75% of all the psychological problems in human beings actually start under the age of 25 and 50% under the age of 15. What does that mean? What that means is that schools are giant petri dishes in which we're either going to grow mentally healthy young people or the opposite. So what do the statistics tell us? Matthew mentioned in his introduction that there was going to be a significant problem in this area. Let's look at the statistics. One of the indicators of bad psychological health is self-harm. Did you know that the rates of self-harm in young women has actually doubled since 2000? And this isn't just scratching across the radial artery. This is self-harm warranting hospitalisation. That's pretty severe. The suicide rate for young women has actually doubled since 1997. And the last 2 or 3 years has seen a dramatic rise, whereas the boy level has actually remained stable. Suicide remains the leading cause of death for young people aged 15 to 24 in our country. It is a disgrace in the lucky country. Did you know that in the average Year 12 classroom, one young person has attempted to take their own lives? There are specific groups which are high risk. We're talking particularly about Year 12 students. We talk also about those young people who are same-sex attracted. And we have to now focus very much on anyone who happens to be female and at school because the statistics are so desperately worrying. When we look at schools generally, 1 in 4 young people have a diagnosable mental illness in secondary school and 1 in 7 in primary. That would have to be the worst it's ever been. But, and here's the rub, what we know is that 80% of the boys and 70% of the girls with these problems never seek help. And that is, quite frankly, a disaster. Because what we know in psychology is that early intervention, prompt diagnosis, and effective treatment and adequate monitoring is associated with a fantastic outcome. So if the young people don't actually name themselves, they basically just sit there. Many of them come to school wearing masks, pretending that they're fine. New data from Beyond Blue says the average time of delay from the onset of symptoms to successful treatment is 15 years. Do you understand what that means? That's 15 years where a young person is unable to fulfill their potential, unable, of course, to tackle the developmental tasks of adolescence. And one group in particular, which is profoundly affected, is our Indigenous people. Their suicide rates are 3 times that of the white Australian. So we need innovation. We need TEDTalks. So what's my idea? I have an idea worth sharing because it's based on what I know about young people in 2014. We know that they see the world very much unlike the adults. They see the world not in terms of online and offline, but seamless. They are the first of a generation that have grown up never knowing life without computers and without the internet. We know that it's getting younger and younger. 35% of 8 to 11-year-olds now own their own mobile phone. Not sure that's such a great idea. Got to be honest with you. Does an 8-year-old know how to manage their digital footprint? Should we be giving an 8-year-old unrestricted access to the internet? Possibly not. And we know that it is part of their growing up. From 10 to 12 years of age, they basically spend 1 to 3 hours a day connected. By the time they're 13, it's basically become the norm, particularly social networking, which I have no problem with, and I'll talk about that in a sec. By 15, the internet has become an integral part of their life. We know that the ownership goes up every year. We know that of all the population, 89% of young people own mobile phones. They are the most heavy downloaders of apps by far. The 65-year-olds download 9% of all the apps. There's not a surprise. And look what they're doing online. They've got social media, they game alone or with others, they shop online, they download and listen to their music. The idea of buying records from a record shop is from another era. And of course they read and watch their news online, they watch and download videos. The idea of a young person sitting down to watch a television set is also a rather quaint idea in 2014. So they love and they use technology. So why don't we use technology to deliver mental health services to them? Why don't we actually understand that this is the answer to the health apartheid? This is the answer to the massive under-resourcing that we have in Australia at the moment. Did you know that 7% of the federal health budget goes on mental health? 3% of the health research budget goes on mental health. We are absolutely the poor cousins, and we have to rise up. We have to do something. Now, the advantages of apps and web-based programs is huge. You've got mass delivery. You can reach huge numbers of young people. It's effective. We know from study after study after study that online delivery, say, of cognitive behavioural therapy is every bit as effective as face-to-face. We know it's cheap. It tackles those help-seeking barriers that I talked about, with 80% of the boys and 70% of the girls not wanting to seek help. And of course, most importantly, it's available 24/7 because young people's problems don't occur between 9 and 5. And of course, how great for our young people in rural and remote Australia, because there are no geographical boundaries, as long as you have access to the internet. And of course, it's anonymous, it's confidential, and most of these programs are really very, very engaging. So what do I want schools to do? I think the time has come to train teachers in the use and benefits of mental health promoting websites. They should be everywhere. A young person should walk into schools and they should be bombarded with, on school screensavers, all sorts of different websites that they can access. We need to advertise and promote these things. We need to promote online counselling, because it may well be that the young person doesn't like or doesn't want to talk to the student welfare staff, but that should that be it? Are we so fixed that we can't offer them alternatives? I think we need to. And we need to promote the major mental health promotion websites. We need to put them up everywhere. We need to encourage the use of social networking sites. Why? Because we know from the research that one of the greatest predictors of well-being is in fact not being good-looking, not being wealthy, not having more good life events than bad, but in fact having a rich repertoire of friends. So all the people who want to say social networking is Satan, you're wrong. The research clearly shows there are massive benefits from having young people online. We need to encourage the use of video gaming as well. And we need to encourage the use, believe it or not, of wearable devices in education. How exciting is that? The answer to many of our problems then basically are very clear to me. We have a choice. We can either continue doing what we're doing, continue to prop up the health apartheid, or we can invest in a technology which is going to dramatically change the life of young people. Fundamentally, what the research has been telling us for quite some time now is that, as Tony Blair says, young people are 20% of the population, but 100% of the future. I believe very strongly in the words of an abolitionist. He said that it was impossible, as I said at the beginning, for people to be brave if they only have good things happen to them. The situation we're now faced with is the internet is our lunar lander. The internet is our lifeboat. And the question is, do schools, do the community have the courage to get into the lifeboat and launch it? The sheer penetration of smartphone use and apps provide us with an unprecedented opportunity to provide real-time, standardised health information and treatment directly to young people in their natural environment. And this will increase treatment access, and it will result in population-level improvement in the mental health of our young people. They are, without doubt, the future, and that is a future that rests very much in our hands. Thank you very much.